I wanted to take a couple minutes and tell a little bit more about the birth story of my second child, Amon, because I realize it's a story for how we all need to learn how to advocate for our own health, that we can't just trust someone who has an MD behind their name, not every time. So, his birth story actually starts while I was pregnant because my blood pressure kept going up. Now, I was 40 when I got pregnant with him, so I wasn't young, and according to the doctors, that's that dreaded advanced maternal age, AMA. Any woman over 35 having a baby is apparently ancient, even though that needs to be updated because women are having babies older and older. Yeah. And it also takes medical advancements way longer than it takes evolution. So, my blood pressure kept going up. And right off the bat, because I was 40 and because I was having blood pressure issues, the hospital that I was going through immediately wanted me on all sorts of medications and bed rests and hospitalizations and everything else. But luckily, I was actually using a midwife, the same midwife I used for my older son. And she was licensed to practice out of this particular hospital, St. Joseph's Hospital. And anytime they told me I needed to come in for a test or I needed to do something else, I would ask her and I would ask my team of midwives. And eventually I realized that it was the tests. It was the constant need to come in every other week to check to make sure I'm still 40 and having a baby and all of that. It was wearing me out, and every time I had to do the test, my blood pressure would spike. So they sent me home with the sample thing to give them a urine sample. I say it's the gallon jug that you have to give a 24-hour urine sample. I had to do that 3 times. Every time they saw that my blood pressure was fine, my diet is fine, I was exercising, everything was fine. They were stressing me out. So eventually I told my midwife, I said, I don't want to do any more of these tests. I don't care. Like, what these tests, all they're doing is telling me what could possibly happen if something went wrong. I'm just going to assume nothing's going to go wrong. Can I just come to see you? And she said yes. So that kept my blood pressure under control for the remainder of the pregnancy. The couple times it spiked, I would meditate, I would eat, I would drink some water and chill, and it would come down. I actually started checking my pressure at home to be on the safe side. So at 37 weeks, I had to have my pressure checked again, and they have to do the long hook me up and check it for an hour thing. And I made the mistake of watching CNN at the time, and this was during the uprising. Okay, it had begun. There were military troops on the ground. There was a curfew going on. It was already intense. It checked my pressure. It was up. And apparently the baby, he had shifted so that he was on the umbilical cord and he wasn't gaining as much and his pressure was looking a little sketchy. So they decided to induce. My midwife said it was okay. Okay. So the first thing that went wrong was the nurses did not follow the orders of my midwife. I went in for the induction. I was given Pitocin. She specifically told them to keep me on the lowest dose, but nurses, medical system, all of that's their goal with labor and delivery is to make it go as fast as possible, to get it out, give you a surgery if need be. It's not meant to be, in a hospital, a birth is not the natural process that it's meant to be. It's a intense medical procedure. So they ignored her orders. And when my contractions weren't coming fast enough for the nurses, they kept upping my dosage. I didn't know this. She didn't know this. So because my baby wasn't ready to come yet, they had to up my dosage to the highest dose of Pitocin, the exact opposite of what she wanted to have. She did not know this. So when she came in and actually broke my water, all hell broke loose. Within 20 seconds, the pain was overwhelming. And I've had a child. I had a 36-hour labor before. I know what this feels like. It was horrific. My entire labor was horrific. She didn't know what happened. She was confused. She went over, checked the dosage. She got angry, asking who upped the dosage when she specifically said not to. They argued. They wouldn't back down the dosage. They wouldn't let me walk around and walk off the pain. No, my blood pressure was up. They wanted to keep me on monitor. So they wanted to keep me strapped to a bed on the highest dose of Pitocin. I didn't want to have an epidural. That wasn't the intention, but I told them if they can't stop the Pitocin, if they can't let me walk around, I could not bear the pain. And it was ridiculous. So they hooked me up to give me an epidural. Now, first of all, they had to actually back down the dosage or stop the Pitocin long enough to give me the epidural because the anesthesiologist said he could not do it with me screaming and flailing the way I was, like a crazy person. So they stopped the Pitocin just long enough to get the epidural in, but then they gave me more Pitocin because, of course, I'm in a hospital. They want fast birth. That's not supposed to happen when it's naturally wanted to. It's supposed to happen on their clock before those nurses change duty or whatever. So they put me back on the Pitocin at the highest dose. I didn't know this. Midwife, again, did not know this. The epidural did nothing. It was completely useless. It gave me a push button that said every 15 minutes, if you need more pain meds, press this button. I completely exhausted that within the first hour. I was over it. So labor was a good 12 hours of utter trauma. So that was Thursday. I went in for the induction. Friday, I had the baby. My blood pressure was at stroke level. So, of course, right after having the baby, they don't want me to do anything but rest. They want to put me on medication to bring my blood pressure down. I told them, I had to keep checking the medication because they kept saying, oh, this is fine for a breastfeeding mom. And then I would look and find out, no, it's not fine for a breastfeeding mom. You guys don't care about a breastfeeding mom. So, yeah, even that was problematic. But then here's the real fun part. I'd already been in the hospital for 24 hours. I had not slept a moment in that 24 hours. So now they put me on these medications, and the doctor who insisted on these medications said to monitor me every 2 hours. Okay. I haven't slept. I've just had a traumatic birth, and now they won't let me sleep because every 2 hours someone has to wake me up, sit me up, and take my blood pressure. Every 2 hours. I dealt with it for the first day. I dealt with it for the second day. By the third day, I couldn't deal anymore. So I'm questioning the nurses. I'm questioning everybody who comes in. You all keep telling me to get rest, but you're coming in here and literally waking me up every 2 hours. They wouldn't let me sleep. They wouldn't allow me to rest while they took my pressure because, oh, that's a resting blood pressure. That's different than awake. You're not going to be sleeping all the time at home. So, in the most illogical fashion whatsoever, you tell someone to rest and then you wake them up every 2 hours, force me to sit upright, take my pressure, and then say, okay, we'll be back in another 2 hours. And then, of course, in between those 2 hours, someone was coming to bring food or get a food tray or take a blood test or check the baby because, yes, my child is staying with me. I would not let them check him out unless they were checking me out. If I'm staying, he's staying because he's nursing. So this went on for about 4 days. So 3 days of me just trying to deal. The fourth day, I started cussing. It took me that long because I was just exhausted. I was just trying to cope with the fact that I had this new tiny baby. He was only 5 pounds. He was a little guy. He was nursing. He was great. He was awesome. He was so sweet in the hospital. Mar was home with the big boy. I was stressed. I didn't want them going back and forth too much because we were still under curfew for a while. It was a lot. So it took me a few days to come to myself and say, what the fuck is going on? And by that time, I'd had to pull in my midwife, and ask her to help, because I said, this is ridiculous. How am I supposed to sleep? How am I supposed to get any rest? They keep upping the dosage of blood pressure medication because my blood pressure isn't coming down. I keep telling them they just need to let me sleep. They say, well, if we don't get this under control, you're going to have a stroke. So they kept upping the medication, not even giving it a chance to work, just upping it and upping it and upping it and not letting me rest. And I'm barely eating and I'm barely functional. So on the 4th day, I called in my midwife. I called in all the nurses, head nurse, charge nurse, whatever she's called, the doctors. I said specifically, I need somebody to tell me why I'm staying in this hospital or I'm signing out right now. Against medical advice, I don't care. I will take my child and walk out the door unless somebody can give me a strong, valid reason for why I'm being held hostage in this hospital. Oh, well, you're going to have a stroke. I need sleep. Then 4 days, day 4 of no sleep, after, this is postpartum, 4 days after having a child, the doctor thinks to maybe check the chart. And when checking the chart, she sees that, oh, I only meant for her to be monitored for every 2 hours for the first 8 hours. After that, it should have gone to every 4 hours and then every 6 hours. But why would it if you don't change the orders and the nurses don't question or challenge anything? So once she says that, I'm like, okay, yeah, I want out of here. I want out. And they were like, well, can you at least stay through the night? I stayed through the night. The next day, they still didn't want to let me leave. They just wanted me on more medication. So the next day is when I actually insisted, okay, I'm going home today. I need y'all to sign me out right now. I need whatever paperwork needs to happen in order to leave this hospital right now. And by that evening, I had managed to sign out against medical advice. However, they gave me a list of 3 different prescriptions they wanted me to fill and insisted that I was going to have a stroke within a day if I didn't get all this medication. My blood pressure, yeah, it was at stroke level. I said, okay. I went home that evening. Me and the baby, we laid down and we crashed for a good 18 hours. We rolled over to nurse, change diapers, sleep. Nurse, go to the bathroom, sleep. 18 hours. I checked my pressure when I woke up. Fine. Perfectly normal. I've checked my pressure many times since then, and not once has it gone back up. And not once have I fulfilled a single one of those prescriptions that they told me that I needed or I was going to die. Not one. And when I look back at them, I realized they had put me on what would have been 1,500 milligrams of various medications every 12 hours. If I had fulfilled any of those things, I would be stuck on them for the rest of my life. My body would be completely dependent on them. So that is my birth and postpartum story that also goes along with how, especially Black women, we need to take charge of our own medical care. If I had actually done everything they told me to do, I would be in so much worse my health, my life would be so much worse. I'd be stuck on blood pressure medication when all I needed was some sleep. Yeah. My child, my little baby, Aman Assad, our protective lion, I worked hard to get him here. I worked even harder to keep him here that first week and to keep myself here. And that's our beautiful birth story.